Cottone. Did I say that right, Tom?
Yes, you did. Yes.
Super. I apologize for the internet in where I live in Birmingham, Alabama. It is, as far as internet, it's ground zero for COVID. But you're truly at ground zero. You're in New York area. And the purpose of this Doc Talk Live is to catch us up on what's going on in New York, but also it's a call for help. I believe you're looking for healthcare personnel in that area to help manage the patients. And I'll say down here, there's a lot of healthcare providers who are just sitting at home quarantining. So Tom, with that said, I'll let you take it from there because your internet's probably better than mine.
Sure. Thank you, Brad, and thank you so much for having me today.
Appreciate it.
So, sure, I'm an anesthesiologist with Long Island Anesthesia Physicians. We are a group who provides anesthesia services for 5 outstanding community hospitals in the region out on Long Island. And we are right now seeing a tremendous number and an increasing number of very ill COVID patients. Our ICUs in each of our facilities have been completely filled with very sick patients. Our hospitals and the administrators of the hospitals and the nursing, the CNOs and the CMOs of the hospitals have been unbelievable by opening up additional ICUs within days of each other. So every one of our hospitals have opened up additional ICUs to help care for these patients. With the opening of all these additional ICUs, we need additional staff. Everybody has risen to the occasion to provide those additional services, but it's going to continue the needs are going to continue to grow over these next weeks and even months, unfortunately.
I would think the biggest concern, if I'm, let's say, an anesthesia provider, such as a physician, such as a nurse anesthetist, if I'm a physician assistant that's used to dealing with patients in the intensive care unit, if I'm one of those type of healthcare workers, a nurse, and I'm not doing anything and I want to help out, my biggest concern is I'm going to come up there and I myself am going to get COVID.
Sure.
And my life in danger.
Sure.
And so I guess that would be the first area that would need to be addressed in terms of travel nursing.
So let me tell you how we got involved and how concerned we were at the same time and how difficult it was even just for us to make the decisions to get increasingly involved to the extent that we are now. About 10 days ago or so, myself and Dr. Jeffrey Rubenstein, who we run the group together, we were brainstorming on how we can help in this situation as we saw the need starting to grow. And again, it was very different 10 days ago compared to what it is now. So we started contacting administrators on how we could help, and they were overly thankful to have that help. And we decided, well, how can we convert? We needed to convert our entire anesthesia group into over 100 providers into a group of providers that could work in the ICUs. So really changing the scope of our practice within days. So to do that, we needed to do exactly what you were saying, make sure that we were in a safe environment where our providers, our CRNAs and our physicians, our surgeons, our nurse practitioners, PAs, everyone as part of the LIAP family could join in this fight against COVID to help out in the ICUs and in the hospitals. So we came up with a plan to have a team approach where we're all looking out for each other when we're at work. And in this team approach, we have our docs who are joining in with placing lines in the ICU, helping intubating patients, going from unit to unit, seeing if they need anything. We're also teamed up with our nurse anesthetists who are becoming ICU nurses, but they are doing it in a team model where they feel comfortable, where they can help out the ICU nurses, so the ICU nurses can take care of additional patients compared to what they are now. So this team model is making us all feel very secure and very safe, where we're working together and protecting our providers. We have such a good.
Tell me a little bit, Tom. Tell me a little bit about personal protective equipment. Yep. And supplies for that, and how that all works. How you use that equipment to keep people safe.
Sure. Sure. So we have the necessary PPE. We have the necessary protective equipment. Our clinicians are provided. We help each other don and doff to make sure that we are doing it appropriately. We have nursing educators throughout the hospitals that help us all, as we're getting used to the environment. And now I'm finding myself, seeing a new floor nurse come to the ICU who's fearful themselves, and showing them how to do it. So we are certainly educating others as they come in and really looking out for them, for everyone. So we have certainly an adequate amount of PPE. I mean, we're concerned about it becoming scarce, but there is plenty right now, and we're using it wisely. The team approach that we have is unbelievable, and everyone helping each other out. As a matter of fact, we just had one of our nurse practitioners that's part of LIAP. Her and her husband donated 10,000 N95s to our hospital system, and again, that's just shows what an amazing dedicated team that we have. So the PPE is it's there. There is enough of it, and we're all just watching each other, using it appropriately.
Now I know y'all pay these providers, and I think folks are getting like much higher amounts of pay. So why don't you let our nurses and our healthcare providers down here, and hopefully they'll see this on a rebroadcast, what exactly y'all are paying, what the benefits are, and whatnot.
Sure. So we are providing an appropriate amount of compensation. It's competitive with the market. It's for, I think, for most people coming in, it's not about coming for the finances. People are coming to help, but we also have to pay them enough where they can keep their, feel like they're feel like they're not being taken advantage of, feel like they are appreciated. That's really feel like they're appreciated.
Well, and it certainly creates an incentive, because a lot of people down here are out of a job right now.
Well, and here, there's no revenue coming in, but at the same time, we want to make sure that people very much feel like they're appreciated. So we have we make sure that they are taken care of, and we have hotels for them to help out. And the pay is certainly competitive for the CRNAs, as well as for registered nurses. We've taken on a number of registered nurses. We have NPs and PAs that are coming in to help us out. As a matter of fact, we have surgeons calling us and saying, how can we help? As orthopedic surgeons saying, I'll work in your ICU if I can help, which is just so touching to have all those people come and help. So everyone, the team of nurses, the CRNAs, the anesthesiologists, the surgeons, all coming together I mean, the silver lining here is just seeing how special everyone is working together and how special everyone's looking out for each other. And it's not just the providers. We have in this community, which is, such a strong community, and everyone looking out for each other. Everyone's coming together. The house people, the receptionists, everyone's coming in the hospital to try to help out as best that they can. So, we live in a small community. Everyone's pulling together. We're strong, but we certainly need some help at this point because we have.
I think I saw that y'all are paying like $130 to $150 an hour for nurses and CRNAs, depending on the skill set. Is that accurate?
Sure. So for nurse anesthetists, we are providing $150 an hour. For RNs, NPs, and PAs, $130 an hour. And that is and those are the numbers that we're providing. And again, for anyone coming from out of state or from any distance, we have arrangements with the hospital system that we work with. They are thrilled to be able to provide a very nice hotel. It's a Hyatt hotel for people to stay comfortable there. And again, the most important thing that I want people know is when should they come to help, we are here for our providers. I take multiple shifts. All the physicians take multiple shifts. We've all joined this team. All of our full-time and per diem staff have joined and are doing multiple shifts, so we have a lot of people joining in. The issue is, it seems like every day there's another ICU opening, and with additional ICUs opening, we're just getting stretched thin.
So what we'll do is we'll post that information hopefully to the main page so people can access that with, I guess, some sort of phone number so they know who to call should they be candidates and interested in helping out. So now let's talk a little bit about, I think, your post-call, right? You just got back from work. You spent the night there.
Yes.
Tell me about your night. Tell us what that consisted of. How many patients are on ventilators? What you did last night.
So we provide services at 5 hospitals, and we're actually trying to help out with a handful of other hospitals in the region as well. So for providing nurses and nurse anesthetists as well. But for last night, I was there as part of the LIAP COVID team. And again, we started this LIAP COVID team about 8 days ago was our first day in the LIAP COVID team.
Wow.
So we have, and it's ramped up very quickly. And a number of the original people, the people that jumped in, feet head first to help us out, we didn't know what our scope of work was. We knew our scope of work was going to be very different than what we're used to, but we just came in and said, we are here to help. So and we've developed into these team approaches. So what I was doing yesterday is I was available for any intubations for patients that might be getting sicker on the floors before they get to the ICU. And then when you arrive to one of these situations, when you're called for that, there's a team of people that have the PPE there for you, that have the necessary equipment for me to take care of the patient. The respiratory therapist is there, and we all, come in and speak to the patient for a moment, let them know that we're going to take care of them, and then have them go off to sleep and provide and get them.
How many patients are on ventilators? How many ventilators do you have left?
So there are dozens of patients that are intubated and on ventilators in each of our institutions. Every hospital is different, but it's between 20 and 30 at each hospital, approximately. There are some, not quite this. There is nearly an equal number of ventilators left, but we also have anesthesia machines that can be used for ventilators. We have rapidly set up. Just a couple days ago, I got a call from one of the hospitals that they're opening up the recovery room as an ICU, and we have our anesthesia ventilators in there. So we accepted that night. I came in to do the first shift because it was really within hours this whole thing got put together. The entire team of nurses made this recovery room into an ICU over hours. I came in, it was all set up. We had a nurse anesthetist with us, and then we were teaching the nurse anesthetist, we were teaching the nurses, the recovery room nurses, how to use these type of ventilators, which no one in the hospital besides for anesthesia providers are used to using. So we still have plenty of ventilators left, but they are diminishing. And all of our hospitals kind of find themselves in this situation of having decreasing ventilators. But there is still enough, but they are decreasing.
Any insights yet? Do you have enough experience with the various experimental treatments that have been brought forward, like azithromycin and Plaquenil and those various things that I guess they tried in China where the data is slim? Do you have any insights into treatment?
So Brad, that is, my role right now. I mean, our hospitals are utilizing the appropriate treatments, of course, on all of our patients. My role right now, and I'm focused on providing staffing to our hospitals to help out the nurses who are getting stretched so thin at this point by providing CRNAs, RNs, and docs into the ICU where we can help in any way possible. So if I've done you asked what I did, yesterday, I was placing central lines and arterial lines for patients available for intubations. But if I'm there and those things are done, I increase the scope of practice to talking to educating people, or to just being available. If somebody needs to be turned prone, I'm there to help. Whatever is needed to help to relieve some of the stress that the ICU nurse is having, that's what we're there for, is to help in any way. And you asked you asked
in
about
a way,
sure.
In a way, you're kind of like almost like a plumber. You're providing access to care. You're putting tubes in so a patient can get the patient.
Brad, I lost you for a second, but you were talking about again. I don't. You froze, but if everyone can still hear me, I'll continue. And sure, we are there. Hello.
Yep, we're back. I think we got into a glitch situation, but okay. I think we're back.
So you were asking about what we're doing technical things as a number of items like that, and that's completely true. We are not intensivists, but we have the capabilities to do all of the procedures and to help out in many ways in the ICU. So that's what that's what LIAP has done. We reintroduced ourselves as a group of anesthesiologists who are now doing ICU work, doing all the things that we need. The nurse anesthetists have jumped in and come into being ICU nurses, but more importantly, helping out the ICU nurses. So performing all of the difficult tasks that the ICU nurses perform, and helping them be able to do other tasks and take care of more patients. So we're really there to help out so everybody can take care of more patients. And you were asking, you're exactly right. This is a plea for help today. And I've been, for the last week and a half, calling so many different people, different programs to see if they can help, starting to get nice responses, but there's so much. Every day that we think we are almost there, where we have almost enough, we never have enough. Where we almost have enough, I felt like a couple of days ago I was 2/3 of the needs, and then the very next day the needs jumped by 40, 50%. And this is just the beginning. This is not a couple of weeks. We feel like this is a couple months in the making. We do not feel like we are just outside the epicenter of this humanitarian crisis, and it's coming to us. It's here, but it's growing so fast. And so, how can people help? I think you were asking about earlier. You can contact us if you're interested in coming out here to help our nurses, to help our staff, to give our colleagues some time to recharge and then get right back into it. We have a dedicated team of who would get back to you right away. Our credentialing is extremely fast. It's disaster credentialing, emergent disaster credentialing right now. It's quick and it's easy. We provide hotel accommodations for people to come out here, and our website is lianesthesia.com. Again, lianesthesia.com. You can visit that and give us a call to see how you can help us.
So hopefully we'll get all this information on the Doc Talk Live page. We'll try to boost it so we can get more eyeballs on it. And I don't know how this will broadcast because of my bad internet access and the whole thing, but maybe during the week we could redo a show or do an update with better internet. So I appreciate you taking the time. I appreciate your hard work. I know your post call, and it seems like you're in a war zone there. So I appreciate you doing this.
Brad, it really does feel like that it is a war zone. When you come into the ICUs and you see how many people are there and how many people are just trying to make everything better and everything safer for everyone. And it would be great to speak again, especially with other people that have really contributed so much. I mean, we have people who are just saying, you know what, I'm going to take the lead on this ICU, this new ICU, which I was there the first day. I had two people come to me who were highly competent. They're anesthesiologists, but highly competent anesthesiologists. And so we now have those two anesthesiologists running that ICU along with another nurse anesthetist as the lead nurse anesthetist. So these are people who never thought they'd be in these roles days ago, and just saying, I'm going to do it and we're going to figure it out and we're going to make sure that the patients are safe and well taken care of. And that's just been everyone's attitude, is how can we help and do more for our patients. And at this point, additional reinforcements would be wonderful.
We need to find a way to link up the various anesthesia groups throughout the country, because, in certain pockets of the country that's basically isolating and quarantining, these groups are not that busy yet.
So sure. So we, as a matter of fact, I completely agree. There's providers like how myself and Jeff were feeling 2 weeks ago. What could we do to help? And we found a way to reinvent ourselves and get in there, not do what we normally do. So another group who has a number of people in the city, they're dedicated out there, but we got a call from that other group, a large anesthesia group out here, to see if that for their providers that are out on the island. And we are forming relationships with, just as you were saying, a relationship with a local group to come help us out in our hospitals. So it's wonderful that people are looking to help here, but there's so much of a need. I mean, whoever comes, we'll need more. So absolutely. So again, thank you. I can't thank you enough for having me on, so we can get that message out.
Well, I appreciate you doing it. I wish this show had a much larger reach, but hopefully one day it will. I really thank you, and I thank you for your hard work. Take care. I'll talk to you soon.
Look forward to it.
Bye-bye.
Thank you. Bye.